Hello everyone, my name is Eun-Suk from the Department of Radiology at Gangnam Severance Hospital. Today, I will present our study on deep learning-based augmented contrast enhancement and denoising for reduced iodine and low radiation 70 kbp cerebral angiography. In cerebral angiography, achieving high vascular attenuation is crucial for diagnostic performance. Traditionally, this requires high iodine concentrations, faster injection rates, or larger volumes of contrast media. However, this comes with the risk of CIA-KI, contrast-induced acute kidney injury, which is known to increase with higher volume, osmolarity, and viscosity of the contrast media used. So the key clinical challenge is this: can we reduce iodine dose while maintaining image quality? Many studies have tried to answer this question. One effective method is using a lower tube voltage protocol such as 70 kbp. This takes advantage of photoelectric effect, which increases iodine attenuation without needing additional contrast. However, the downside is clear: image noise increases significantly. Therefore, iterative image reconstruction has been used to reduce the image, but this noise issue is not completely resolved. To solve this, we applied two specific deep learning algorithms developed by Clarify. The first is DLACE, which is used to boost vascular contrast enhancement. It uses a neural net architecture trained with dual and CT dataset to predictive iodine map. By adding these predicted synthetic iodine images to original images, we obtain images with augmented contrast enhancement. Algorithm's detail is described on this slide. And second, we applied DLDN, which is the denoising algorithm. It uses a model trained with pairs of standard dose CT images and stimulated low dose CT images to predictive noise images. By subtracting these predicted synthetic noise images from original images, we obtained images with reduced noise. Therefore, the purpose of our prospective study was to evaluate the feasibility of 70 kbp cerebral angiography with reduced iodine and low radiation, and the effect of DLACE and DLDN algorithms on the CTA. We enrolled 47 healthy volunteers and divided them into three groups. Group A, representing our standard protocol in daily clinical practice, used 100 kbp with 40 ml of 350 mg iodine per milliliter contrast, resulting in total iodine of 14.0 gram. Group B, designed for reduced iodine load and 70 kbp protocol, was administered 40 ml of 270 mg iodine per milliliter contrast, resulting in total iodine of 10.8 gram. Group C, designed for further reduced iodine load, which is ultra low iodine dose, and 70 kbp protocol, was administered only 28 ml of 270 mg iodine per milliliter contrast, resulting in total 7.6 gram. For Group B and C, we applied DLACE and DLDN algorithms to see if we could maintain or improve image quality despite the reduced input. So finally, we defined 5 distinct groups. Standard Group A with filtered back projection, and Group B and C processed with either FBP or deep learning algorithms. We analyzed image qualities across these 5 groups. We performed both quantitative and qualitative analysis. Quantitative metrics included vascular attenuation, image noise, and CNR, contrast-to-noise ratio. We also measured ERD, edge rise distance, and ERS, edge rise slope, for evaluation of arterial boundary sharpness. qualitative image analysis was independently performed by two radiologists with 5-point scales including arterial enhancement, arterial sharpness, image noise, and overall image quality. Let's move on to the results. There were no significant differences in age, sex, height, and weight across the groups. Groups B and C saw a 23.7% reduction in CTDI volume and a 22.3% reduction in DLP compared to the Group A, which represents the standard protocol in daily clinical practice. Iodine dose was substantially reduced as well. Group C achieved a nearly 46%, 6.4 gram reduction in iodine load compared to the Group A. Now let's look at the quantitative analysis. First, the yellow bars in the graph represent images processed with filtered back projection. With FBP, arterial attenuation was significantly higher in groups B and C than group A. However, CNR did not differ significantly due to higher image noise in groups B and C. After applying the LICE and the LDN, shown as the red bars in the graph, arterial attenuation increases by 45.4% and image noise decreased by 34.5% in groups B and C, resulting in significantly higher arterial attenuation, CNR, and subjective image quality compared to group A. This is the details and numbers of quantitative analysis, including ELD and ELS. Let's move on to the qualitative analysis. Qualitative analysis was performed using average scores of the two radiologists. With FBP, the scores for arterial enhancement and sharpness were higher in Group B and C than Group A. However, there was no significant difference in image noise between Group B and C and Group A. In Group B, the score for overall image quality is higher than Group A, but there was no significant difference in Group A and C. After applying deep learning algorithm, all subjective image quality scores were higher in Group B and C than Group A. Here are the image examples. We can see original exterior, MIP, and VRT images from Group A with FBP. Next are images from Group B with FBP and deep learning algorithm. You can see higher vascular attenuation and image noise in Group B with FBP images compared with previous Group A images. As a result, you can see that the CNR is similar in Group A and B with FBP. After applying deep learning algorithm, you can notice substantial enhancement boosting and noise reduction. As a result, all qualitative metrics are improved compared to FBP reconstruction. Now let's look at the images from Group C with FBP and deep learning algorithm. You can see slightly higher or at least maintained vascular attenuation and higher image noise in Group C with FP images compared with Group A images. After applying deep learning algorithm, you can notice substantial vascular enhancement, boosting, and noise reduction as well in Group C. So we can observe all 5 groups image here. This is original exterior images, and this is MIP images. Can you see the differences? We can see the significant image quality improvement in images using reduced iodine load and low radiation with deep learning reconstruction. In summary, Cerebral angiography using 70 kVp using reduced iodine load and low radiation substantially improved vascular enhancement but did not improve CNR due to higher image noise from lower radiation dose. However, by applying the LICE and the LDN, we can substantially improve arterial attenuation and reduce noise simultaneously, resulting in more than doubling of CNR and improved subjective image quality. Our study was limited by a small sample size of healthy volunteers and did not yet include clinical outcomes like diagnostic accuracy for patients with vascular disease. Future large-scale investigations in neurovascular patients are necessary to confirm this benefit in clinical setting. Thank you for your attention. And if you have any questions, feel free to leave them in the comments or contact me by email.